Oh, no. Would you look at this?
That's the first tailored white coat I've ever seen.
Oh, isn't he lovely?
Lovely.
Think he knows anything?
Knows how to dress.
Well, he's my student. I'll find out. John Carter.
Yes, sir.
Peter Benton. You the surgical student?
Yep, third year.
Good. We're going to be spending a lot of time together, so let me show you around so you'll be oriented. This is the admitting desk. If you need someone paged or a chart called up, you do it here. This is Timmy. Don't shake his hand. He's afraid of disease. This is the way to the lab. We do crits, counts, spin downs. Chemistries are marked with these slips and left at the front desk. Mark everything stat, whether you want it fast or not. The chem lab is 7022. The heme lab is 6944. Memorize it. Everybody gets an IV the minute they walk through the door. Use an angiocath with a 16 needle. You need a large bore in case they're bleeding and you need to transfuse them. Do you know how to start an IV?
Actually, no.
I thought you were third year.
I am, but all I've done is dermatology and psychiatry.
The well-dressed specialties, huh? Well, you find that surgeons actually try to help people, not just build them. Now, the best way to do this is to pull the skin tight so the veins don't roll and go in low. Once you're in, pull the gizmo out and hook it up to here. This is Carol Hathaway, the head nurse. John Carter.
Hi.
She's terrific, isn't she? She goes with an orthopod that used to be a Big Ten tackle and looks like King Kong. Now, what you want to do is you want to tape it, moderate flow, 2 or 3 drips per second. That's it. That's all there is to it. Okay?
Okay.
All along here, you have the medical examining rooms. This is where the pill pushers kill their victims. But this is the surgical room. This is where the real action is. We use this phone to call the OR, 6440. X-ray is around the corner. They're a bunch of idiots. Scare the patients and make them wait too long. So whenever you can, make sure you go with the patients to X-ray. Don't let them get scared. Don't let them get hurt. Here's Dr. Morgenstern. He's the head of ER. Watch out. He eats students for lunch.
David Morgenstern.
John Carter.
When did that severed hand go up?
A vascular took it up an hour ago. I just hope they can do it right.
Dr. Benton is one of the best residents we have. You learn everything you can from him, except attitude.
He didn't mean that.
Yes, he did.
Your room will be down here. That's where you'll sew people up. Do you know how to suture? No. Okay, I'll teach you. Do we have anyone to sew up?
How would I know?
You know, I love this great spirit of camaraderie. Everyone wants to help, you know. Okay, here's the suture room. Let's see. Good morning, ma'am. I'm Dr. Benton. This is Dr. Carter.
Good morning.
Okay, let's have a look. How'd you do this?
Broke one of the breakfast dishes.
Don't worry. I'll have you fixed up right away. Now, can you feel this?
Yes.
Can you move your finger?
Of course, it's just a cut.
Dr. Benton, we have a policeman coming in with a gunshot wound to the lower extremity.
Put him in room 2, notify X-ray. I'll be right there. Now, here's all your stuff. Ask the patient if she's allergic to the locals or any drugs. And this is lidocaine. We'll call it Novocaine. They've heard of that. Ma'am, are you allergic to Novocaine?
My teeth are okay.
No reactions, rashes, anything?
No, of course not.
Now you inject both sides of the wound, expelling as you go. And you have to put on surgical gloves by yourself. You know how to do that, don't you? Great. Here we go.
Hey.
Here you go, Dr. Ross.
Thank you, Nance.
Dr. Ross. Hi, Tracy Young. I'm your third-year student.
Well, hello, Tracy Young. It's nice to meet you. Listen, for the next few days, we're going to be working very closely together.
Well, not that closely, Dr. Ross, but I'll do my best to help you out. So, if you tell me what to do, I'd like to get started.
Just trying to be friendly.
I've got all the friends I need, thanks. Shall we get started?
Yeah.
Now invert the wound edges and space them because the tissues will be swelling over the next 48 hours. Space them the way that you see here.
Dr. Benton, the policeman's here.
Okay, I'm coming. Here, you finish.
Okay, this isn't gonna hurt at all.
So you elected not to cardiovert?
He seems stable.
Hypotensive with chest pain?
The pain was controlled.
Somewhat.
Let's continue, please.
Could be a wide complex tachycardia.
Was that a consideration?
I felt it was rate related.
Which it wasn't.
No, heart rate dropped. EKG shows an acute inferior wall MI.
Why the delay on the intubation? You had the bad gases.
I was hoping he'd come around with bagging. When I got the gases back, I tubed him.
So you recommended drug therapy, TPA?
I do angioplasty with my MIs. Jumping in with TPA messed everything up.
He had no contraindications, you weren't available, and time is heart muscle.
I was on my way.
I didn't know that.
People, please, it's just a teaching session. What was the outcome?
Did the angiocath and it was a mess. Bled like a stuck pig. Before I got to the angioplasty, his heart rhythm went haywire. Shocked him once, and he came around. EKG came back to normal, the artery opened.
So you never did angioplasty?
Well, I could
And
hardly...
TPA worked.
Yes.
Dr. Benton, what would you have done?
Angioplasty.
Dr. Langworthy?
Angioplasty.
Dr. Green?
Angioplasty.
Don't turf me a patient without a chart.
I'm sorry, I thought I...
Don't apologize, just do your damn job.
Ignore him.
More charts, that's great. Any more exciting, I'll check myself in.
Dr. Ross,
Yeah.
Rescue 61's bringing a woman with severe head trauma. All the neurosurgeons are tied up in the OR.
Divert the woman to St. Luke.
So, who died and left you chief resident, huh?
Mark's got the flu, I'm covering.
Whoa, whoa, whoa. St. Mark is out? Must be pneumonia.
Hiya, Peter.
Sarah?
You too excited? Announcements today?
I know how to read a calendar, Halle.
What announcements?
Starzl Fellowship.
Maybe you noticed Dr. Benton's a little anxious.
Dr. Ross, they needed your double D-5 upstairs 20 minutes ago.
I will send them 4 pints of my blood. What is a DD5?
It's a shift status report. You're supposed to fill it out.
How does Mark do all of this?
He puts in 4 hours after every shift.
I'll tell you, Jerry, I will do anything to get him down here. I'll put him on a drip. Give him my next 4 paychecks. I don't care how sick he is.
Come, don't answer.
Might be right. Craig!
Who's Craig?
Just from this other clerk.
Yeah? Call him back.
Hello? Hello? What the hell?
She called you from the street?
35th over in Bridgeport.
Mark?
Look, are you certified or we need to call in a counselor?
I'm certified. She say anything?
Carter, do me a favor. Take this needle. How long have you been out?
Coming up on 2 minutes.
What about a needle, Craig?
Not yet. What are you doing?
I'm going in.
I said not yet.
Halle, hook up a 3.0 ET tube hub to a cath and bag them. Hyperventilate now.
O2 sats up to 95.
Start them on 750 milligrams ceftriaxone, IV Q12.
Son of a bitch.
You lose a fellowship, so you have to prove something. Dr. Benton, otherwise known as God.
You couldn't get the tube in.
I had plenty of time to crike him myself.
Oh, yeah, another 90 seconds. That kid's brain would have been mush.
Exactly right. 90 seconds, and it's my choice.
Oh, yeah, well, the kid's alive,
He's
isn't he?
my patient.
Oh, so it's okay if he dies, right?
Oh, so you're the only person that can keep him alive.
It was a judgment call, Doug. One I should have let you make.
You lost a fellowship today, Peter, not a patient.
You know what I look like in there?